Okay, well, let's get started. Hello, and welcome to this webinar entitled Transforming the Effectiveness of Hospital Marketing. I'm Esri, and I'm the Chief Medical Officer and Health Solutions Director at Esri, and I'll be joined today by my colleague, Jared Schultz, our Technical Specialist for Health and Human Services. Before we get to the webinar, I wanted to start with a few housekeeping details. This webinar is being recorded, so as long as you've registered, you will be sent a link early next week, providing you with access to the final recording. For the duration of the webinar, you'll be in listen-only mode, but we do want to hear from you, so if you have questions or comments, please go ahead and put them into the questions box on your screen, and we'll address them at the end of the presentation. This presentation will also include some polling questions, and we'll simply ask you to make your relevant selections as they come up. I expect the content of the presentation to last for about 45 to 50 minutes, okay? So let's go ahead and get started. This webinar is the third in our three-part series on market planning and marketing functions for hospitals and health systems. I hope you've joined us for the entire series, but if you missed anything, don't worry, you can still get access. The first and second webinars are available on demand at the URLs that I've listed here. So let me briefly review. The first webinar, The Results-Oriented Provider, was an executive-level overview explaining the value of employing a geographic approach to your market planning and marketing functions. The second webinar, titled Building a Location Strategy for Market Development and Planning Departments, focused on providing more depth with a technical review on the marketing development aspects of the business, whereas today's webinar is meant to show you how you can leverage location information in every stage of your marketing workflow. Another resource I've listed for you is the blog I published called How to Effectively Grow Your Health System Footprint, which is available online. Now, if you have joined us before, you're familiar with a simple graphic I've used to explain our purpose in presenting this series. Given your overall market potential and your current market share, we're focused here on strategies that will help you grow and optimize your facilities, your service mix, your workforce recruitment, and your marketing and outreach tactics to capture as much of the market as possible. To show how we do that, the next hour is planned as follows. I'll spend just a few minutes providing an introduction to the concept of using location as a value-based strategy for your health system marketing efforts. And then Jared and I are going to take you through a three-step marketing workflow, starting with planning and targeting your marketing efforts. Step 2 is about getting the work done as you execute your strategic marketing initiatives. And finally, we'll show you how to spatially track your campaign effectiveness in the evaluation step. We'll leave, again, about 10 or 15 minutes at the end to address your questions. At Esri, we believe that a geographic or location-based approach can unlock data's full potential in every organization, and we call this the science of where. You know, as the world undergoes this digital transformation, our company is working to constantly innovate and pioneer geospatial technologies so that you can capitalize on that visual language of maps and employ advanced analytics to create positive change for your organization and for the world. Relevant to today's discussion, someone coined the term geomarketing to emphasize both the comprehensive nature of this approach as well as the many benefits you can realize when using it. Those benefits range from leveraging population segmentation data to profile your ideal clients, to prioritizing your markets based on their potential for your specific services, all the way to allocating your campaign resources most effectively. Geographic tools will provide you with greater insight into what's going on in your markets. And you want to use those insights because there can be significant differences in people's preferred channels for getting information from one place to another. That requires a data-driven method for tailoring your outreach for your greatest return on investment. So that's a lot to think about. Let's break it down by services. What you really want to do is increase the number of high-value patients to make your health system more profitable or sustainable. And the planning component, let me ask, can everybody hear me? Can somebody pop in and let me know? On the planning side, I got a message that I couldn't be heard.
Yeah, we can hear you now.
Okay, sorry, I heard that I popped out for a minute and didn't want to do that. But anyway, we were talking about how you don't want to just increase your number of patients, but you want those high-value patients, again, so that you can be more profitable if your health system is for profit, or sustainable. And the planning component of doing that begins with lots of data and, of course, a way to make sense of it. I'm sure you're well aware of this, and you probably already do make use of data about your current patients, demographic information in your market, and perhaps even some behavioral and lifestyle characteristics. Using this information and your historical knowledge of what makes an ideal target population, you can create a profile that can now be identified on a map. That's going to provide business value in a number of ways. You'll be able to quickly identify where current patients are located and where marketing activities will reach the greatest number of existing patients and new potential patients. You'll leverage geographic lifestyle data to select relevant marketing channels, and you'll allocate marketing resources more effectively in areas with low penetration but high concentrations of your target profile. So at this point, I'm going to hand it over to Jared to demonstrate this part of our workflow. Jared, it's all yours.
Well, thanks, Esty. Well, to develop an effective marketing strategy, health systems need to first clearly understand and articulate their goals in order to target and plan their efforts strategically. Having a simple goal of increasing the number of patients is useful, but refining this goal to increasing the number of high-value patients in an existing service area is better. This goal focuses activities on attracting patients that can significantly impact the health system's profitability and are more likely to visit their facilities based on their location and proximity. In order to realize this goal, ArcGIS technology allows health systems to delineate their existing service areas based on the location of current patients and the distance they're willing to travel. Equipped with this information, marketing professionals can produce detailed reports and patient profiles that can be leveraged to locate current potential areas with high concentrations of key patient segments and develop a data-driven marketing strategy. All right, so let's go ahead and switch over to our demo. On screen right now, you're seeing Business Analyst Desktop. And the first thing that you're seeing here is the location of all the patients that are linked to individual facilities in these 7 different facilities in this health system. You also see this color-coded lines here, which is another function of GIS analysis, that is connecting each one of my patients to each one of my facilities and then given a drive time. So now I can see how far existing patients are driving to get to these facilities. And these drive times range from less than 15 minutes all the way up to 90 minutes. And they take into consideration street networks and directions, speed limits, and traffic and everything else. So you get a real good idea of what's going on with your patient travel times. All right, so if I go ahead and turn these 2 layers off, all this information together allows me to generate primary and secondary service areas that are actually based on the location where my patients are coming from. Here you can see a mix of primary and secondary service areas, the primary being the yellow, the secondary being, where 75% of your patients come, which is a combination of the yellow and the red here. And you can see that it varies across metropolitan areas, where you have densely populated communities all around the facility, to some more, different type of urban and, suburban areas out here. So you can see that the service area for every one of these facilities are different and very unique. And being able to delineate it in this manner helps you move forward with a lot of different things using GIS. So let's go ahead and look at some of the information, these patient segmentations or patient profiles that you can produce once you have these areas delineated. Right here, I generated a demographic and income profile report for all of the primary and secondary service areas in the service area for the entire health system. So what I'm looking at here right now is actually the complete report for the entire service area, and I get some basic information, not only census information from 2010, but since Esri has its own team of demographers and statisticians, we give you a current year estimate for a lot of the demographics and an estimate 5 years into the future. And we do this for a lot of different variables, age breakdown, race, ethnicity, and so on. We could, go through a lot of these right now, but let's just go ahead and look at our next level of information that we can get to. While this demographic information is very useful, some other information that's very useful to marketing and strategic planning activities is market potential or existing spending in the area. So here I generated a medical expenditure report also for the entire service area for these facilities, and I've got information for current year and 5 years out in the future. And some really valuable information here is I can start looking at different types of spending on medical care, physician services, hospital room and hospital services, get the average amount spent as well as the total, and then a potential spending index here that's also developed by the team here at Esri, where 100 is the average for the US. So you can kind of target areas that have higher rates of spending for specific services that you're interested in. You can also look at the payer mix in a particular area if you want to target a particular type of payer, such as Medicare, Blue Cross Blue Shield. We also have that information here also. Alone, all this information is very useful, but when it's combined together using a neighborhood segmentation tool, Esri's tool is called Tapestry, it helps you understand your customers' lifestyle choices, what they buy, how they spend their free time. Tapestry classifies U.S. residential neighborhoods into 67 unique segments based on demographic and socioeconomic characteristics. So in this particular report here, I am seeing the patient-derived service area for the third health facility in this health system, and I'm looking at the primary service area, which is where 50% of the patients are coming from. And now we can get rank order delineation of all the segments, the neighborhood segments, where my patients are predominantly coming from. Here I can see the professional pride, soccer mom, savvy suburbanites, which in and of itself doesn't mean a lot, but once you start exploring these individual segments, you start to see the real power and utility of being able to use these in your marketing activities. This particular group, Professional Pride, which was the largest segment in my, my patient profile, the communities that I'm serving here, has a median age of about 40.5. I get my median household income here, which is also useful information as I'm going out and try to develop some marketing campaigns. Once I start looking in a little bit more on this particular segment, I can see that these are heavy commuters living in the suburban periphery of large metro areas. I get a lot of information about their neighborhoods, where they shop, what kind of things that they listen to, what they read. I get some nice breakdowns on how these areas compare with the U.S. on average, which is very useful in understanding these communities. But some of the real secret sauce from a marketing standpoint is the market profile. In this particular one, I can see that these are the frequent travelers. So maybe travel advertising on travel sites and different types of publications related to travel might be useful. I see that they're very digitally connected. I'm doing a lot of shopping on Amazon. They're going to different big box stores. They have tablets and different types of devices. So, it may be that I determine in order to best reach this particular market segment, that I want to focus in on a digital marketing campaign. So there's a lot of insight that can be gained from these types of tools. Specifically, Tapestry has a wealth of information being used by marketing professionals from a number of different industries. Well, once you use this detailed geographic, demographic, and lifestyle information, ArcGIS users can locate similar target markets across their service area and focus on locations with heavy concentrations of key patient segments while factoring in existing penetration rates. They can further prioritize these markets based on lessons learned from past successful campaigns that led to an increased number of high-value patients. All right, well, that all sounds good, but let's see how it actually works. Let's go back to Business Analyst Desktop here, and let's turn off my service areas, which I were using as a basis for these individual reports, and start looking at some type of the analysis output that we can generate from here. First thing I wanted to do was map out my market penetration on areas I'm already at. I used zip codes as my unit of analysis here, but you can use any analysis unit that you want. And I can see here, once I overlay my patients, I'm just simply showing the market penetration on current zip codes that I'm already successfully, forayed into on with my current operation here. Well, if I take this to the next step here, I can look at my target map. And my target map is based on the existing penetration rates that we just saw, as well as the key segment characteristics, those tapestry segmentation profiles, that helps me identify where the mix of those different market segments are that will present the same type of patient population that I've already successfully penetrated across my organization. Let's go ahead here. Well, the next thing we want to do is generate a market penetration map, actually a target penetration map, which shows me some valuable information here on where I could expand into. So let's go ahead here, look at some of the wizard-driven tools that we've developed specifically for marketing workflows. So let's go ahead and do some segmentation charts and reports in my targeted marketing tool set here. Then I want to go ahead and generate some new analysis. I want to do some maps to get that visual representation. Now I want to do a target penetration map. And this will help us determine the concentration of our target segments at any key level of geography, as I mentioned before, using our penetration rates and those ideal profiles. So let's go ahead. And I can select any one of the different market segments I'm interested in, but I want to key on specifically the ones that match my existing patient profile. Professional pride is included in there because that was the top one. And then I can go ahead and select my unit of analysis here. I'm sticking to zips on this one, but like I said, you can go down to block groups, up to counties, and even higher scales. And then my segmentation base, I'm going to go ahead and use households for this one rather than just the adult population, because we're, in our health system, we're serving all sorts of different types of patients. Then I want to create this report. Then I would go ahead and give it a name. I'm going to go ahead, I did this prior to the demonstration for the sake of time. I've got my target penetration map here, which gives me that information to really know where I can expand into. And you see that they're color-coded here based on, these penetration rates that we've had at each one of the individual patient segments. Well, if I take this to the next logical step here, I want to start prioritizing these areas. So which ones should be my core areas that I'm evaluating for my marketing campaigns, and which ones are more niche or kind of ones that I may want to consider in the future. So here I've established my core areas that are predominantly made up of the communities that match the demographics of our ideal patient profile and we've had the success in before. And so basically I went from over 500 potential zip codes in this area down to 112 and then further limited it down to these 89 core areas. As I move forward with this demonstration, I'll be using these 89 core areas to further, hone and target my campaign. All right. So what exactly did we just see? We saw that by leveraging GIS technology in this manner, health systems can find locations in their service areas that have similar demographic profiles as their current patients. And they can also prioritize these areas based on existing levels of penetration, desirable characteristics, and market potential. Once these locations are determined, a health system can select the marketing mediums and messaging that will better reach and resonate with key patient segments based on their lifestyle preferences. Everything you just saw was completed using Esri's Business Analyst desktop software. So now let's go ahead and do a quick poll and see how all of you guys are accomplishing similar tasks. All right, to what extent are you using location information in your marketing and planning activities? Not at all, a moderate amount, or a location is part of all decisions? Give you a second to respond here. right, I'm not seeing the response back yet. All right, so 9% not at all, 20% moderate amount, and 64% location is part of all decisions. Well, that's great, because you're clearly understanding, that location of your patients, your facilities, and your services should be a key part of your marketing strategy. What I'd like to, kind of maybe follow up with in our question and answer period is on whether or not y'all are using GIS tools in order to address this, because GIS tools are natively designed to deal with location and provide you a lot of opportunities there. All right, so let's go ahead and launch the second part of this poll, which is question 2. Check all location-based activities you're currently performing. Are you mapping out your existing patients? Determining market penetration rates geographically? Identifying areas of opportunity with high-value patients, gaining location-based insight into patient lifestyles and preferences. Looks like preferences got caught up there. I'm not currently using location-based activities at all. I'll give you a minute to respond. All right, let's see what the responses are. All right, so 56% mapping existing patients, down to 0 for a couple other ones, 33% not using it at all. Well, it's not surprising that mapping existing patients is the biggest use right now. This is very common, and just the ability to geocode patients and facilities and put them on a map represents the initial step towards using location to improve marketing activities. Knowing where your patients are at in relationship to your facilities lays the foundation to conduct every other activity we have listed here, and that are made very simple, using GIS software and methods. All right, let's go ahead and move to the next part of our discussion here.
Thanks, Jared, and I'm so glad that everybody can hear you very well. At least I can, because you're presenting really critical and great information. So to everybody, if we think of our step 1, that planning and targeting marketing efforts, as this global view to our marketing workflow, resulting in a set of clear target areas where our desired patient profile lives, then in step 2, executing strategic marketing initiatives, we're going to focus in and get more specific. Here we're going to talk about what goes into the development of any particular marketing campaign that you plan to initiate. Now, we're not just talking about the places where your target patients live, but we also want to include the services to market to specific areas and which marketing channels will be most effective. In this step, we'll determine the best location for our marketing resources based on habits and preferences of existing patients and those high-value market segments. And we'll be able to easily communicate our marketing campaign focus and targets to our stakeholders with interactive and engaging tools. So, Jared, why don't you go back and show them how it's done?
All right, that sounds great. So we've already identified the core areas we are considering targeting with our marketing campaign based on multiple factors. In this example, the result of the identification process was 89 different zip codes. In the previous webinar, we further limited these 89 areas to 5 optimal areas to add a new facility or expand our referral network. As Esri mentioned, you can go back and review the recordings from any of these previous webinars to see how that was done. In this example, we will refine this list of core areas based on a number of suitability criteria that help locate areas of high-value markets and determine the correct marketing channels. For this demonstration, we want to locate areas with high numbers of digitally connected Medicare recipients that are frequently utilizing hospital services to target an advertising campaign by buying impressions on different digital and social platforms. The same workflow could be used to locate areas with high spending on and access to public transportation, to advertise in the public transit system, to locate high concentrations of commuters, to place billboards, or determine what television and print publications may resonate with particular market segments. All right, with that, let's go ahead and switch over. Okay, so now what you're seeing is Business Analyst Web. And there's a lot of capabilities here, nice wizard-driven steps, and tools that allow analysts and other users using these tools to very quickly flow through some standard workflows here. I'm going to go ahead and conduct a suitability analysis, and I've already shared out all these 89 core areas that meet the different criteria that we were looking at before across the ArcGIS platform, so that I can easily have different people on my staff having different roles and responsibilities in this overall marketing workflow. So I'm going to go ahead here and do a suitability analysis. I want to add sites for my project, do all 89 of these zip codes that were already shared out, and then I want to start adding some criteria here. I want to further limit these out based on different types of factors that are important to my campaign and to my overall health system here. So let's go ahead for my data browser, and I want to go ahead and see what kind of information I have in this this wide variety of Esri premium content that's available here to try to locate Medicare recipients. Do a quick search here and look at consumer spending data that we've kind of engineered into the system here. I can see Medicare payments. And I'm going to go ahead and just look at, the number of Medicare payments there. So that's the first variable that I want to use. Next thing I want to go in, maybe explore some of this curated health data. I've got a lot of different information in here that I can use, but I want to focus in on some more type of market potential spending information. And I really want to focus in on, areas where the consumer spending is high on hospital rooms and hospital services, and I want to do that based on an index. So I just want to kind of look at areas that are higher than the average for the U.S. So now I've got Medicare spending on a particular type of service. Let's go back here, and you can see I have a breakdown of a lot of different things that I can do. I could look at unemployment rates. I could do different age groups, preferences, education levels. I'm going to go ahead and look at behavior. Since I'm trying to target a digital marketing campaign, I want to kind of use this metric of individuals that have a smartphone here, and I'm going to do the percentage, because I really want to focus on areas where there's a high percentage of smartphone owners. So go ahead and apply. And again, I could select a number of different variables here, but let's just start off with these three. And then it's going to go ahead and give me those options so that I can go ahead and include them in my filtering process. Well, next thing I wanted to do is add some information. You've got a wealth of data in your own internal systems here. And so in this example, we've kind of demonstrated how you could take existing sales volume from all of these areas that you've identified and kind of use it as a criteria, kind of thinking that, you've already penetrated these areas on some level. And you've got some brand recognition in those areas. So it may be good to expand your patient base in this area and be able to get other patients to come in for, additional services that they need, whether they be, preventative or, for other types of issues. So now I want to go ahead and I have my different options here. I'm going to go ahead and weight those. And I'm going to go say that, the location of existing Medicare recipients or spending on Medicare is very important. So I'm going to go ahead and weight that as 40% and lock that. And then I got this way to set my slider bar here. So I want to look at areas with, let's say, over $10 million worth of spending. And then I can go ahead and look at my hospital room and hospital services. And again, this was the index variable. So I'm going to go ahead and set an ideal range. And I'm really looking for areas that are, above the average for the U.S. But it's not that I wouldn't consider other areas, but I just want to, kind of rank those differently. And then for my smartphone percentage, we'll see I want to make sure it's set to positive. I want to skew towards areas that have more smartphone owners, and we can see that it's 56 to 78% across the board here. So this is they're all good areas. And then sales volume, and I can adjust that however I want. Let's just go ahead and set a whatever value. Again, these are all user defined threshold values here. So I'm just going to go ahead and select that. And now let's see what my results are here. So what I quickly see are all of the zip codes that I've narrowed down to, and you can see my table is linked directly back to my map here, and I can see that the highest ranked area is right here, and I can see why it was the highest ranked. It had a final score of 0.8 with over $25 million worth of Medicare payments. a higher than average medical services index, hospital room and hospital services specifically. 78% of the individuals are smartphone owners, and a decent sales volume in the area. I can see my individual scores and my weighted scores for each one of those. Okay, so then let's go ahead and kind of dig into that area a little bit more. Let's zoom into the highest ranked area. All right, here. So my highest ranked area ended up right here. And if I look at that area, I can get all the same types of reports that I had before. We're seeing all the different areas that we evaluated. And I go ahead and look at an infographic for that area to kind of find out a little bit more about what's going on. Quickly, I can see the default infographic, but I created a specific infographic for this digital campaign here. And then I can see all of my different information, my different charts, graphics here. Let's go ahead and pull this back up. Okay, and I'm going to go ahead and break this apart. I mean, I can export this out into HTML image format and print it, but I want to go ahead and show it as a slide view so I can kind of walk through this. And so here I can see that these are the locations being considered. And now I can see information like the total population now, the income, as well as the change across time to make sure I'm located on growth areas here. I can see the individual area that I'm looking at for my marketing campaign here, one of the targets, and see what's going on around that area, look at it with different views. To get at my internet access here, I can see the percent of individuals with computer or cell phones. And then some of those target statistics that I was really focused in on, specifically Medicare payments. I can see that information here, and other types of payments. And education levels, of course, very important to target my marketing message. And the overall spending. So I can share this information out, embed it into other presentations and tools so that I can easily communicate our targets and why we've chosen what we've chosen to other areas on the team or other members of the team. Let's go ahead here. That was one specific workflow, but you have all these other areas that maybe you want to target for different types of activities here. So you've got a lot of other additional tools here. Say that I wanted to, look at specifically what we talked about before, which was mass transit. I can go ahead here and look at inner-city mass transit fees, and then just look at, maybe index, average, the number, whatever I want. Let's go ahead and look at the number here. Then I can quickly overlay that information. Let's go ahead and turn off our suitable areas here. And so now I can see where the spending is on mass transit, that may help me locate, where I'm going to put different advertising directly on the subway system, on the signs around it, whatever the case may be. Another example, that I saw from, the Tapestry segmentation report was these particular individuals like to shop at different big box stores. So say that I wanted to go ahead and locate all the Home Depots in the area. And overlay those. And now I can go ahead and start looking at combinations of other types of information that helps me target my campaign, which may be, areas around, Home Depots, mass transit, where to locate billboards, where to do a lot of different things here, all through using some very simple, easy tools that allow you to kind of get at the root of the matter very quickly. All right, so what exactly did we see? So once these strategic growth goals are established, a savvy marketing team has to ask the right questions to properly focus their efforts and ensure the greatest return on their investment. Systems have to be structured to easily share strategic planning results across an organization so all team members can collaborate effectively. In order to determine what marketing channels to employ, And what service and messages will resonate with key patient segments? Large volumes of internal and external data has to be included in interactive and iterative analysis. Gathering this information, outside of these types of tools takes a lot of time. Pulling it from Census Bureau and different types of data providers. But, ArcGIS provides the tools to accomplish these tasks and a mechanism to easily communicate the results with attractive infographics and reports. Everything you just saw was completed using Esri's Business Analyst web software. So let's go ahead and run a quick poll and see how you guys are addressing some of these same challenges. So how difficult is it for you to simultaneously analyze multiple factors to inform your marketing campaigns? Give you all a minute to respond. You got easy, reasonable, average, difficult, or it's just impossible. All right, so let's go ahead and see what our results are here. Easy, 17, reasonable, 25, difficult. Okay, well, this is not surprising. Being able to integrate all these different sources of information together is very difficult, especially when they're not using a geographic framework. One thing that we found at Esri is most of the data in an organization also exists in a number of different systems, and it's often hard to integrate those systems. But one of the key elements that exist in all your different data sets is geography, whether it's the location of your facility, locations of your patients, where they're coming from. So once you start taking geography as your integration tool, it makes it much easier to overlay this information and kind of get it in this common framework that you need for analysis. All right, let's go ahead and move on to our next section here.
Well, I've got to say, I am a big proponent of evaluation, really thinking about evaluation metrics and ensuring that the tremendous work that you put in actually results in the outcome that you wanted. And that is what step 3, evaluating the effectiveness of marketing campaigns, is all about. Ultimately, you want to ensure that you got your return on investment. In other words, you increased your market share. And you do that by checking your target marketing results. Did your messages and channels perform as expected? And some campaigns can be quite large and complex, and you need an easy way to analyze the entire campaign. Jared will demonstrate this third and critically important step in the marketing workflow. So Jared, it's back to you.
Thanks again, Esty. All right. So we've already completed the process of defining our overall campaign goals and locating the best markets, messaging, and channels to utilize, but this is not the end of the story. Marketing is an iterative process. In order to ensure campaigns are effective, key performance indicators need to be established and monitored using simple tools that have current metrics and are easily accessible by key team members. ArcGIS provides the ability to quickly configure dashboards to pull any of the information used throughout this process or from any other source of data available in your organization in a simple and easy to use view. So let's go ahead and see that. Okay, so here what you're seeing is a operations dashboard. We're calling it the marketing metrics dashboard. And let's start looking at what we've got going on here. So we've got our total campaign conversion rate, because we're using a number of different ways to track all of these, different marketing messages that we're sending out there on different platforms. And we want to know how many of these, these tools that we're putting out there is actually being converted to some type of lead, whether that is a follow-up call, a click-through, whatever the case may be. So we can track the overall conversion rate for the campaign. But then if we want to start looking at this geographically, we can see these target areas. We've identified 7 target zip codes that were pulled from our core areas that we've kind of really focused in for buying our digital impressions on these different platforms, or for placing different tools, types of advertising, whether it be print or physical. So here, if I go ahead and click on any one of these areas, I can go ahead and highlight it on the map. Again, one of the big powers of GIS is being able to link all your charts and tables and maps together. Let's see here. Let's go ahead and zoom to that area. And before I was just seeing the street network. Here I overlaid aerial imagery on it, where I can zoom all the way down in and see individual buildings and what's going on in the infrastructure. Is there parks around? Walkability. I can determine a lot of these things from here. Well, then I can go ahead and click on any one of these areas here, and I get the information on the zip code, how it's scored on my suitability criteria. But I also get the individual, the conversion rate, for the different assets I've placed in this location, broke down by digital leads, direct mail, television, and signage, which are all information that I'm gathering from other tools that I've been leveraged in this GIS environment. Now here, I can also roll up all of these leads for my different campaigns by media type. So say that I wanted to see the digital number, the signage, whatever the case may be, I can go ahead and track it and then zoom into this geographically as I just showed. Well, then I want to track some other metrics. I mean, from this campaign, how many patient visits do I have linked to it? Through different mechanisms I'm using to track the touch points for the campaign and what the outcomes are. And then more importantly, from this campaign, how many new target patients have I acquired, which is really, where my long-term sustainable, business growth is going to be coming from, expanding out what my existing patients are doing, but also gathering new patients into this, into my network here. And then kind of a big picture roll up, something that's more representative of how we're performing. Are we meeting our regional market share goals yet? We've set a threshold goal here of 75%, and we haven't quite reached it yet, but I can monitor these things, the same types of things executives in my organization want to be making sure that we're improving on with these campaigns and activities. And then I can break that regional market share down by each one of the facilities. And then I can also look at whether or not I'm starting to decrease the leakage I have across time, across my health system or individual facilities here. So all of these different tools and metrics are very useful in order to understand where you're having successes and where you are not having successes. Okay, let's go back here. Let's kind of summarize here. So in order to gauge the effectiveness of marketing campaigns, health systems need to constantly monitor and evaluate results to ensure the desired outcomes are being produced. Quickly configure dashboards displaying key performance indicators and the progress toward reaching specified goals provide an intuitive way to track and measure outcomes so tactics can be updated based on the performance. Everything you just saw was completed in Esri's operations dashboard. All right, so let's go ahead and poll the audience here real quick. Okay. So are you formally evaluating the success of your marketing campaigns? I'll give you a moment to answer. All right, so let's see what you got. Uh, 25% yes and 75% no. That's interesting because if these campaigns are going out, I mean, I'm sure different aspects of them are going to be more successful than others. So if you're not able to properly track the performance and the success of the campaigns, it's hard to feed that information into a data-driven marketing strategy where you're modifying things as you go. But again, it's not easy to get all these metrics and engineer them in, and that's one of the things that we're trying to demonstrate here with the GIS platform. It allows you the tools and the capabilities in order to start tracking these things and be a little bit more data-driven in your approach. All right, let's go ahead and ask one more question here, then we'll be done with the polls. What metrics do you consider most useful to gauge the effectiveness of marketing campaigns? Lead conversion rates and target locations, number and origin of new high-value patients, changes in utilization rates across your organization, or all of the above? I know a lot of you said that you weren't, tracking the effectiveness of it, but this is just to get you to start, thinking about, what types of metrics you could use. All right, so let's go ahead and see what our result is. All right, so lead conversion rates by geography, not, the number of origin new high-value patients, changes in utilization, all of the above. Okay, so, I can see that, we've got a split here on which ones are most useful. And again, location, makes it, much easier in order to, kind of look at each one of these in a simple and unified framework. All right, so let's go back to our slides.
Great. Hey, Jared. Thank you so much for showing us how to accomplish this entire marketing workflow. So you may have noticed that Jared mentioned the tools that he used to perform the analysis during each section of the presentation. For the planning and targeting marketing efforts, Jared used Esri's Business Analyst desktop product. In executing strategic marketing initiatives, step 2, Jared did the work with Business Analyst again, but this time he used the web version. And for the evaluation step, Jared simply configured the operations dashboard. And these tools are all part of Esri's larger ArcGIS platform. Now, the platform could be described as a system of systems. ArcGIS can support multiple types of systems. For example, it becomes your system of record for all of your geographic information, much like Outlook may be your system of record for email. I think you certainly saw that this is a system of insight capable of several hundred analytic processes and visualization methods so that you can be aware of what's going on and be responsive with data-driven decisions. And ArcGIS is also a system of engagement. It facilitates this in many ways by making collaboration possible, breaking down silos, as well as making communication easier with clear and engaging methods to share, present, and work with information. The reason I want you to know about the full platform is because this is where you have the power of scalability and extensibility. Platform systems can grow as you grow. So, you may be asking yourself, how can I get started? Well, I'd like to invite you to visit our website at go.esri.com/planning. And while you're there, be sure to check out our story map that provides an interactive experience summarizing the topics in this entire webinar series. And don't forget to scroll down the page to this section here that'll show in just a moment. Now, this is the place where you can provide your contact information with any specific interests that you have, or you can call us directly at the number that's shown. We really welcome further discussion with you to see how these tools might help your specific organization get the greatest value from your market development and geo-marketing activities. At this point, Jared and I will be happy to answer your questions. So if you haven't done so already, please go ahead and add your questions to the questions box. Now, Jared, we do have a question to start out with, and someone has asked, how often does Esri update their business analyst data?
You know, that's a great question, because it's easy to go out there and find data, but make sure that you're using the current data and it's kept current is much more of a challenge. So I showed you a bunch of different data sets here. When I talk about, the current year and the future year data from a lot of the demographics and the other stuff, Esri doesn't update this every year. So our current year demographics is 2016 right now. Our projection 5 years into the future, 2021. Next year we'll have 2017 demographics with 2022 projections. So that premium type of content there of our demographics and other information is updated on an annual basis. The street networks, the imagery, and a lot of the other data that I accessed here is updated on a continual basis when it's accessed through a lot of these maps. and then the specific data sets that come with business analysts, because you can access it from, using desktop or this web environment, is updated on an even more frequent basis with data packs being sent out with updates. So we've got a pretty rigorous update schedule to make sure that the data that you're all using to make important decisions never gets stale.
Thanks, Jared. And I wanted to ask you, now I know that you've used Esri products for a long time, but you're relatively new to the business analyst products that you're showing here, and now you're demonstrating them and doing all sorts of great stuff. And I thought maybe you could provide a perspective to others who might be seeing this and wanting to learn it for the first time. How difficult or easy was it for you?
Well, that's a great question too, and that's been a concern from a lot of people about doing kind of a foray into GIS, is that it's really just for GIS analysts or folks that understand how to do all these different methods and tools. But really, the way these tools are set up and structured, both the web and desktop tools, they're very specifically designed around different workflows that you step through. So when I was learning, it seemed like things were very intuitive. If I wanted to look at marketing, I look at the marketing menu item. If I want to do a trade area, I look at the trade area. And then as I walked through each one of the individual steps, it kind of guided me to what I needed to look at. So even if I wasn't a GIS analyst, maybe I was specialized strictly in marketing, or I was a data analyst and coming from another area, it was intuitive enough for me to kind of walk through and understand what was going on, and being able to do it in a way that I could recreate it and track it. And if I did get kind of hung up along the way, there was a lot of documentation that's out there. There's some online training, tutorials, videos, and a lot of things that even sample data that make it a lot less daunting to be able to figure out how to walk through and use these tools effectively.
Thanks. So we have another data question. Someone would like to know, what are the sources for most of our data, and specifically the healthcare related data?
Oh, that's a great question too. The demographic information is built off census. The ACS census, the decennial census, and then we use a lot of other sources that are out there. A lot of the health data that I was showing was related to consumer expenditure, and a lot of this is coming from the Bureau of Labor and Statistics. Market potential is based on consumer surveys compiled by GfK MRI. And then our retail marketplace, business data is coming from info group. So, we pull from a lot of different sources in order to make this composite data set, and all of our methods are available online and documented, and these data sets have performed very well, as far as stacked up to other types of, similar data sets that are available out there.
Great. I was glad to hear that you mentioned that it is documented so people can take a look and make their own decisions and see how it compares to other data sources that they may have had an interest in. I think that documentation is incredibly important. Another question for you. You showed Business Analyst Desktop and Business Analyst Web, and what would you say are some key differences, or what is the best way to use each one? I mean, we kind of showed them for different parts of the marketing workflow, but maybe you could say a little bit more about what's different about them.
Yeah, that's great. Well, of course, a desktop product is going to have some desktop components and installs on there. So if an organization is not looking to have that type of a footprint, then maybe the web-based tools would be more useful to them. Now these tools are not an either or. In Business Analyst Desktop, I have a lot of enhanced capabilities to say, delineate my patient-defined service areas, do a lot more, complex spatial statistical analysis. That's not just tools that are built into the wizards of Business Analyst Desktop, but that are leveraging the full suite of capabilities that are available in our desktop products. And then in Business Analyst Web, it's a much simpler GUI kind of wizard-driven interface with less tools that are available, but give you the ability to address a lot of the same key workflows there. But then it also gives you the ability to collaborate, in this web-based environment, very easily. It's designed around this collaboration idea with these attractive infographics that can be immediately shared out and tiled through. So you really got to look at, the individual needs of your marketing operation, how big it is, what's the need for sharing, do you have existing GIS staff, are you going to task existing marketing staff, and ask a number of different questions here to determine what's the best fit for your organization.
And we can help with that, right? If somebody wants to talk to us and tell them what their needs are and what they're trying to accomplish, we can give them good advice in selecting the right components.
Yeah, we've got a team of people that are, focused in on healthcare, that know how this is being used and have examples of how it's been used in other areas. Plus, we've got a whole organization full of people that, that have been supporting different industries that have been using, business analyst tools as well as other tools to support, people from the GIS professional down to, one-person shop that's doing some of these things. So, we know how to fit you with and kind of right size your implementation in your tools.
Very cool. Well, Jared, if you can advance to our logo slide, I'm not seeing any additional questions, so I'm going to go ahead and wrap things up. I just want to tell everybody that we really do look forward to helping you achieve success in your market planning and marketing activities in a way that truly only a location strategy can provide. Thank you so much for spending the time and joining us today.